I am Yvonne Butler, one of the senior associate consultants in the Department of Obstetrics and Gynecology here at the Mayo Clinic. Today I'll be discussing my article titled Ebola Virus, Exposing the Inadequacies of Public Health in Liberia. So I had actually worked in Liberia for the past 2 years, serving as faculty with the Baylor College of Medicine and supervising residents in the first OBGYN residency program in the country. It was during this role that in February we actually first heard rumblings and rumors of an Ebola virus outbreak in Guinea, and shortly thereafter in March the first 5 cases hit Liberia in the northern part of Liberia, approximately 12 hours from where we were practicing. It was at that time that we grew concerned, but perhaps not as concerned as we maybe should have been given the current scenario. We continued as usual. The state of public health in general in Liberia is actually quite devastating. I was one of only 3 OBGYN providers. There were numerous issues regarding shortages of the basic things like water and electricity, as well as basic medical supplies, including antibiotics, personal protective equipment that's used on a daily basis like gloves and gowns. So we were concerned about how the Ebola virus disease was spread, but again, it hadn't really hit like Monrovia yet, where we practiced, the capital city. So we continued until about the end of February, April, when we had the first case of Ebola, not at our hospital, but a hospital that was about 30 to 40 minutes away from us. That was concerning because we then realized that patients would soon start trickling in with this disease, and we had no preparations for it. We had no method of protecting ourselves and no method of actually offering support, medical support to the patient. As I contemplated the events from April through June when I left, and then the current events, I realized that much of what we now know about the virus is that it's spread by direct contact, which really means that if you have your basic personal protective equipment and supplies in a solid public health environment, you will most likely not only protect yourself, but you will be quite successful in protecting others from the transmission of the virus. Liberia happens to be one of the more tragic cases of public health where, unfortunately, due to the lack of really the basic medical equipment and supplies that we really take for granted here, gloves, gowns, shoe covers, IV fluids, basic medications like antibiotics, basic medications to treat fevers, are things that patients there cannot take for granted because it simply is not available, and if it is, they really just can't afford it. So my point was really to state that while we're really focusing on vaccines and the latest and the best technologies for improving patients' care here for patients that are now being transferred with EVD, the reality of it is perhaps we should really concentrate on what are our public health strategies, what resources do we have, and how do we teach others that those basic public health resources, which are actually not very expensive, can save the lives of many that we've lost thus far.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.